If your prostatitis keeps coming back, after antibiotics, after months of treatment, after everything your doctor gave you, I need you to hear this. The antibiotics didn't fail because the bacteria were resistant. They failed because in most cases of recurring prostatitis, there are no bacteria. The infection was never the problem. The problem is what's creating the conditions for inflammation to return, over and over again, and until those conditions change, nothing you take will stop the cycle. Today I'm going to show you what those conditions actually are, and the 6 changes that genuinely break the pattern. I've spent over 25 years in urology and internal medicine, and prostatitis, specifically chronic prostatitis and chronic pelvic pain syndrome, is one of the most mismanaged conditions I see in men over 40, not because doctors don't care, but because most treatment protocols stop at antibiotics and never address the underlying drivers. Today we go through what actually causes recurring prostatitis and 6 evidence-based changes that stop the cycle. No surgery, no long-term antibiotics. Let's start. Here is what most men are never told after their first prostatitis diagnosis. Up to 95% of prostatitis cases are classified as type 3, chronic prostatitis and chronic pelvic pain syndrome. This type has no detectable bacterial cause. Urine cultures come back negative, swabs come back clear, yet the pain, the urgency, the discomfort return repeatedly. What is actually driving it is a combination of pelvic floor muscle dysfunction, chronic inflammation, nerve sensitization, and poor pelvic circulation. These 4 mechanisms feed each other in a cycle. Tension creates poor circulation. Poor circulation creates inflammation. Inflammation sensitizes nerves. Sensitized nerves create more tension. Antibiotics break none of these links. This is why men take course after course of treatment and the symptoms return within weeks or months. The cycle has to be broken at multiple points simultaneously. That is exactly what these 6 changes do. The pelvic floor is a hammock of muscles that runs across the base of the pelvis, supporting the bladder, bowel, and prostate. In men with chronic prostatitis, these muscles are almost universally in a state of chronic hypertension, meaning they are constantly contracted, even at rest. This chronic tension restricts blood flow to the prostate, compresses the pudendal nerve, and creates a low-level inflammatory state that never fully resolves. What causes pelvic floor hypertension? Prolonged sitting, especially on hard surfaces, chronic stress, anxiety, cycling without proper positioning, even years of holding tension in the lower abdomen unconsciously. The fix: paradoxical relaxation and pelvic floor physiotherapy, specifically learning to release, not strengthen, the pelvic floor. This is the opposite of Kegel exercises, which are wrong for this condition. A pelvic floor physiotherapist who specializes in male pelvic pain is the most effective single intervention available for type 3 prostatitis. The prostate sits directly at the base of the pelvis. When you sit, especially on a hard chair, car seat, or bicycle saddle, the weight of the body compresses directly onto the perineum, restricting blood flow to the prostate and surrounding tissue. For men who sit 8 to 10 hours per day, at a desk, in a car, on a sofa, this is a daily mechanical insult to an already inflamed structure. Research shows that men in sedentary occupations have significantly higher rates of chronic prostatitis than those who move regularly throughout the day. The fix: stand and walk for 3 to 5 minutes every 45 minutes. Use a cushion with a central cutout, specifically designed to relieve perineal pressure, for prolonged sitting. If you cycle, check saddle positioning with a specialist and consider a noseless saddle. The prostate is exquisitely sensitive to systemic inflammatory signals. What you eat directly influences the inflammatory environment in which the prostate operates, and certain foods predictably trigger flare-ups in men with chronic prostatitis. The most consistently reported dietary triggers across clinical studies: alcohol, caffeine in excess, spicy foods, acidic foods, and refined carbohydrates. These compounds either directly irritate the bladder and prostate lining or elevate systemic inflammatory markers that amplify local inflammation. Conversely, an anti-inflammatory dietary pattern, rich in omega-3 fatty acids, quercetin-containing foods, zinc, and lycopene, has documented benefit for prostate inflammation. The fix: for 4 weeks, eliminate the 5 main triggers entirely. Assess symptom change, then reintroduce one at a time. Most men identify 2 to 3 specific triggers that drive 80% of their flare-ups. Quercetin, found in onions, capers, and green tea, has the strongest clinical evidence for prostatitis symptom reduction of any dietary compound. Of all the factors in this video, this is the one that surprises men the most, and it may be the most important. Chronic psychological stress directly activates the sympathetic nervous system, fight or flight mode. In this state, pelvic floor muscles contract, blood vessels constrict, inflammatory cytokines increase, and the pudendal nerve, which supplies the prostate, becomes hypersensitized. Men under sustained work stress, relationship stress, or financial pressure show measurably higher rates of prostatitis flare-ups. This is not psychological. This is a direct physiological pathway, cortisol and adrenaline creating the exact tissue environment that perpetuates chronic pelvic inflammation. The fix: the same interventions that reduce cortisol reduce prostatitis flare frequency. 5 minutes of slow diaphragmatic breathing twice daily, specifically activating the vagus nerve, has been shown in clinical studies to reduce chronic pelvic pain scores significantly within 4 weeks. This one is simple and consistently overlooked. When you are chronically mildly dehydrated, urine becomes concentrated. Concentrated urine contains higher levels of irritating compounds, uric acid, ammonia, bacterial metabolites, that inflame the urethral lining and prostate with every void. In men with chronic prostatitis, inadequate hydration prolongs every flare-up and prevents healing between episodes. The target is pale yellow urine throughout the day, not colorless, not dark. That color indicates adequate hydration without overdilution. The fix: 6 to 8 glasses of still water daily. Reduce coffee to 1 cup maximum. Caffeine is a direct bladder and prostate irritant at high volumes. Avoid carbonated drinks during flare-ups. The carbonic acid directly irritates the bladder mucosa. A useful addition: 1 to 2 cups of green tea daily. Catechins in green tea have documented anti-inflammatory effects on prostatic tissue specifically. This is the factor most men are never told about, and it has the strongest direct physiological rationale of any item on this list. The prostate continuously produces prostatic fluid. Regular ejaculation clears this fluid from the gland. Without regular clearance, fluid stagnates within the prostatic ducts, creating a biochemical environment that promotes inflammation and bacterial overgrowth. A study published in the Journal of the American Medical Association, tracking over 29,000 men for 18 years, found that men who ejaculated 21 or more times per month had a significantly lower risk of prostate inflammation and prostate cancer compared to those who ejaculated 4 to 7 times per month. The fix: regular ejaculation, the research suggests at minimum 2 to 3 times per week, is a legitimate evidence-based intervention for prostate health. This should be part of every prostatitis management conversation. It rarely is. 6 root causes and 6 fixes. 1. Pelvic floor hypertension. See a pelvic floor physiotherapist. Learn to release, not tighten. 2. Prolonged sitting. Stand and move every 45 minutes. Use a cutout cushion. 3. Inflammatory diet. Eliminate alcohol, caffeine, spicy food for 4 weeks. Add quercetin. 4. Chronic stress. 5 minutes of slow diaphragmatic breathing twice daily. 5. Dehydration. 6 to 8 glasses of water. 1 coffee maximum. Green tea daily. 6. Infrequent ejaculation. Regular clearance is not optional. It is physiological maintenance. None of these require a prescription. All 6 together address every mechanism that keeps prostatitis returning. You are not treating a flare-up, you are removing the cause. That is the difference between managing prostatitis and actually ending the cycle. If this was useful, hit like. It helps more people find this information. And if you're not subscribed yet, do it now. Every week I put out information that your doctor simply doesn't have time to explain in a 15-minute appointment. Take care of yourself. I'll see you in the next one.